As many of you know, IVC filter, our opinion of them has changed with time. I think historically they were placed and kind of forgotten about, and with time, the problems and warts with IVC filters became apparent, so much so that the FDA uh, even had a statement about it, saying that IVC filters should be removed within a certain time period after they're no longer needed, or the risk of PE has been mitigated. In our practice, we try to be aggressive about tracking our patients after IVC filters are placed and have them removed. But that could be challenging from center to center, and especially if patients are treated in setting of trauma or single hospitalizations, and then they leave that hospital and don't have established care set up to track that. Um, Retrieval rates are admittedly low nationwide, anywhere from 11 to 46%. So there's a lot of room for growth in terms of managing these IVC filters. This is a great arena for evaluating tools that can help coordinate care longitudinally and actually capture patients who otherwise may go unfollowed, and the complications of filters may follow them around lifelong. Aidoc did some internal studies with their tool that they created for IVC filter management, and they showed accuracy in identifying IVC filters in reports. So it's an NLP-based algorithm. This increased IVC filter identification at least 2.7 times, and increased retrieval rates and follow-up by at least 87%, which is pretty drastic and encouraging. And I think it offers a great tool for us to reclaim patients who may have had a filter placed and then kind of went off into the wilderness without any follow-up. You kind of feel bad for these patients who may not have even known if they were very sick at the time when a filter was placed. And so it's not really, you can't really put that liability on a patient to track some of these things. It's the healthcare system in general. We're treating someone at the time for something very serious, and an IVC filter is placed, and it's hard to really keep track of it. So the way the tool works is it looks at reports, and you can find anybody that had IVC filter placed based on their radiology reports. The tool itself is very sophisticated. It's customizable to how you like to follow your patients, and what information may be important for you in selecting these patients. What I really appreciate about it is that there's appointment integration. So as I'm following these patients up, I can track if imaging was scheduled, if they came to clinic, and the time that imaging may have been ordered to the time that a procedure is scheduled, if the patient decides that that's what's best for them. And if patients are not showing up, we can also track it that way too. So it really does help with longitudinal care and follow up with these patients. There's two kind of different tools that I've used with this. One is patients that have had IVC filters placed. So anytime IVC filters placed at Sinai, we will get a record of that, and it will tell us who did it, when it was placed, and then we can appropriately send it to that person to say, hey, this patient had a filter placed by you over 3 months ago. It may be time for you to consider bringing them back for clinical follow-up and discussing filter retrieval if appropriate. The other powerful tool that I've been doing a deep dive on is IVC filter mention. So let's say a patient comes into the ER with abdominal pain or even chest pain, or any type of chief complaint to the ER, but the imaging has an IVC filter mentioned. We can then create a master list of all the patients that have come in who have an IVC filter mentioned. And then through that, kind of work backwards to see, okay, which patient has been lost to follow, which patient has had a filter placed, and it was meant to come out, and it hasn't, and now it's been so and so time, and it's time to come out.